shortly, or Nikki?
Yeah.
Yeah, recording has started. Okay, welcome everybody to our public board meeting for January. A little bit belatedly, it's doesn't feel like the happiest new year that we can be marking, but it is the first board of 2021, so nevertheless I shall note that. We have a number of observers today at our board, and I just wanted to welcome everybody. I know we've got a number of our governors observing us today, so I particularly wanted to thank our governors for joining our meeting today and taking time out to observe the meeting. And also wanted to welcome David Mayer, who is our Deputy Chief Executive Designate, and I think David is observing our meeting as well. So hopefully everyone can hear us clearly, and as I said, I just wanted to welcome everyone and make sure everyone could just noted who was observing. So I don't think we have any apologies for absence today, but if there are, Richard, could you let me know?
I'll defer to Jane on that one, Christy. I don't think we've had any apologies.
No, it looks like a full list. Jane?
No, I haven't had any, no.
Okay, thank you. So for items on the public agenda, are there any declarations of interest? Okay, thank you. And then in relation to the minutes of the meeting held on the 26th of November, so first of all, I'd like to just check for any items of accuracy, please. So has anyone got any comments they want to make in terms of accuracy on the minutes of that meeting? No? Okay, thank you very much. Are there any matters arising that aren't covered in the actions from that meeting or on the agenda? Okay, thank you very much. So let's have a look at the actions. Just make sure. Now, certainly looking at them earlier, they were either all completed or had been paused due to obviously the pandemic. There were a number of items relating to board development, etc. So board to consider the approach of the externally facilitated review. So that is something we specifically said that we would defer to later. So unless there are any further comments on the actions, I think there are details of the sort of position on each action quite clearly laid out. So it's really there for noting. I can see that Richard wants to come in. Richard?
Thanks, Christy. Just quickly to note that in relation to the action for the ICS development plan, we've just included a copy of the final letter that was sent for information, and that's paper S. Okay,
thank you very much. So that's there for us to note the final version. Okay, so I think we just note the position on actions, and thank you for all the updates on those provided. So the first main item on our agenda is in fact the organisational risk register. Before I do that, I'm conscious there is our forward plan as well, but I don't think there's, certainly having looked at that myself, I don't think there was anything to draw to the board's attention. So if everyone's happy to move on, I will ask Chris to come in regarding our organisational risk register update. Chris?
I can hear Chris talking, but from next door, I think he's on mute.
Chris,
sorry about that. Yeah, just to say, I assume you want to take it as read, Christy.
Yeah, please.
So the joint committee was unable to meet, but each committee reviewed the risk register. I think on the data risk, Richard might want to come in on that when I've finished. Just the highlights, we're going to keep the recovery position under review. The main element was that the workforce risk was reviewed, particularly in Q&G, and a number of issues were raised, particularly around the challenges for staff and whether our well-being was in place and working effectively. That was subsequently followed up, and a full briefing was given to the board development, where the board received significant assurance on our approach to well-being and the engagement of staff in that. Also a proposal that with workforce being such a high level risk, we group those together in future, and that's work that Fiona, the Director of Corporate Governance, is pursuing to actually think how we can slightly reformat the presentation of the risks, so some of these themes are profiled, given a higher profile, and we can pick them up ever more effectively than we do at the moment. So I think those were the main items really, unless anybody's got any questions for particular risk owners.
Okay, so any questions or comments? Angela?
So I think it was really helpful that we had a chance to look at the workforce bundle, if you like, and get a chance to look at that in some depth. I think this is the one where we're going to need to keep very dynamic on this, because the workforce changes, the demands, the ever-present COVID situation means that it's never going to be complete. We've got to keep this very live, and would look to all board members to support that.
Thank you, Angela. I'm sure we would. Richard?
Yes, so as Chris mentioned then, I think the paper talks about work done around the data quality risk, but some new information has come to light. So we want to just take that out of the board back to the exec team, just to give that some more consideration before we come to any final conclusion on that.
Okay, thank you, Richard. That's helpful. Noted. Thank you. Melanie?
Hi. Yes, I thought it might just be helpful as well to update everyone that as the wellbeing lead, or the national wellbeing guardian, sort of role within NHFT, I'm attending an event later for the National Wellbeing Guardians Network, and I'm looking forward to being able to sort of share good practice and look at ideas that the national role recommendation might enable within NHFT. Just also to say that the wellbeing group is reinvigorated, and I have the opportunity to join that. And also it was very useful, I think, yesterday as part of the WDS co-production, but also I attended on Tuesday, I think it was, the EDI Champions Network, and it was useful to get some feedback directly from the front line, if you like, on some of the wellbeing challenges and the wellbeing initiatives that NHFT have already rolled out and how appreciated they are. But generally just to get that sense of direct from the front line, the assurance of how critical and what an area of focus this is for our individual teams, supervisors and managers.
Thank you, Melanie. That's really helpful. Thank you. Fiona?
I just thought it might be just worth reminding the board, again echoing the point that Angela made about the importance of the workforce risk and the well-being and managing capacity and so on, that obviously we did discuss this with the Council of Governors at its meeting in January and provided assurance to them. The NEDs were able to provide very good assurance to them about the way in which they'd actually looked into this risk, and I think that's worth recording for the board.
Thank you, Fiona. And so another Scott.
Sorry, just trying to come back on. So yes, Kirsty, just very briefly, just to update that fully support the comments that Angela and others have made. Actually, the intention of the joint committee is to focus again on the workforce risks appropriately when we are able to meet in a sort of coherent fashion. Wasn't possible to do that the last time. Actually, just for a brief correction, the committee did actually meet. It just didn't meet with a focus on workforce. We actually diverted our focus and actually looked at ICS related matters instead. But given the level of importance associated with workforce risk, we absolutely do intend to return to it, and it remains a key focus area for us going forward.
Thank you, Scott. And of course, I think it's been really helpful to focus on the wellbeing element. And as I think Chris said at the beginning, at our in board development workshop that we had a few weeks ago, that was obviously a topic of discussion. And I think we all recognised, whilst there was, there was very positive assurance around the offer and the work that we were doing to support people. I think it's important to note the difficulties because of the sheer pressure of workload, and I think we accepted that the reality was that it is actually very hard to we're doing as much as we can, but it's very hard to take away the effects of the operational pressures, and I think we just need to note that, because that certainly struck me as very forcefully when we were discussing it. So thank you for everyone's comments on that, and really helpful that I think Melanie added her own sort of insights from attending the various fora, and then no doubt we'll get some helpful insight into the national focus on this through the Wellbeing Guardian event she's attending. Are we going to take the opportunity just to comment on anything around Brexit, which was obviously one of the risks we had, and therefore did have it on our agenda previously, and then of course COVID, winter planning. So there's a sort of list of other items that are risk related that we've got. So did June want to say anything about Brexit first of all?
Yeah, thank you, Krishni. So I think from a EU exit perspective, the Trust had all the necessary arrangements in place in line with national directive from December. As yet, we haven't seen any impact of the EU exit, and we're monitoring that really carefully. But at the moment, everything is looking positive. Yeah,
thank you, Jean, and right and proper that you called it EU exit as well, because I think that is the correct terminology. And I think we didn't actually, we decided that we no longer needed to have it on our risk register because once it had been stood down. So this is really, it was obviously something that was now, clear that it was going to happen. So I'm wondering whether actually we need to keep sort of referencing it now. No doubt you will bring it to our attention if actually there are any emerging issues that we need to be dealing with. But can we now take it off our agenda? Is there as in terms of automatically adding it under the risk item, I think is what I'm saying. So any views from anybody about that? Or is everyone just happy for us to remove it, Jean?
I think it would be appropriate to remove it, considering the non-issue we're having with it at the moment.
Yeah. Okay, Scott?
Yeah, just to support that point, I mean, obviously, from a purist perspective, EU exit has happened, so therefore it is a risk that has crystallised.
Yeah.
And therefore, it moves from being a risk to an issue that we must continue to manage, so it should come off the risk register for that reason.
Yeah, I mean, I think for clarity, I don't think it was actually on the risk register, or was it? I mean, as far as I understood, was it, Fiona?
Yes, it was on the risk register.
Okay.
A year ago, it was on the risk register.
Okay. But I certainly wanted to remove it from the ongoing updates, and I think that's the point here. So we also have listed COVID-19 and system-wide winter planning. Did you want to make any comments here, Jean, particularly? I mean, obviously there are huge impacts I'm sure we would want to talk about, but I wasn't sure whether we'd be picking anything up later in the agenda.
It isn't specifically on the agenda later. I think that the board is probably aware of the significant pressures that all of the operational teams are under, and clinical teams, and in fact corporate teams. Everybody is really coming together and working collectively to try and mitigate the impact of this on everybody. So there's obviously significant system pressures, regional and national pressures, and the board is aware that we went into a level 5 incident on the 4th of January, I believe it was. And we are having daily calls, both within the system and then via Angela across Gold with LPT to try and monitor and manage the situation. So all the information has been provided in the flash report, Krishni, so I don't know what level of detail you would like me to go into, except that we are working very collectively together as a partnership.
Yeah, so thank you, Jean. I was going to say, I mean, obviously the board is kept regularly updated on matters. So I think it's, is there anything that we particularly, any colleagues want to comment on? I know I can see that Itai's mentioned in the chat and the comment boxes around vaccine supply, but are there any issues with vaccine supply that we need to be concerned about, or from a system point of view? Not that we can actually do anything about that as a board, but just for awareness, really, as much as anything.
I don't think so at the moment. I mean, I think vaccine supplies will be an ongoing issue throughout the year, but at the moment, I don't think there are any specific issues the board should be aware of.
Okay. Thank you. Noting that the board is receiving regular updates regarding COVID matters, and actually nationally there's obviously quite a lot of communication as well that board members may be individually signed up to. I'm not proposing that we ask for any more information unless anyone's got any other questions. Okay. Shall I bring Chris back in then, Chris, just to talk about, did you want to make any comment about the interim governance arrangements at this point, Chris?
Yeah, just a couple of quick comments, if I may, Krishni. So this is the governance arrangements we've previously had. We reviewed those and took them to SEB. We have tweaked them slightly from the original in that we've defined a bit more clearly the position with governors, and we sort of said in the new pandemic that the level 2 committees we would presume wouldn't meet unless chairs have a strong case for that, whereas previously we'd left it to chairs to determine that. I think colleagues will be aware of the overall governance. The thing we do need to highlight is that in discussions with the exec team, if we were to go in, if we ourselves as an organisation would go to level 5, and it's important to get a sense of what level 5 would be. This would in effect mean, the hospitals were completely blocked. Nothing but COVID was happening, really. We're close to it, but it'd be very serious, that we would actually then move away from this to a position where, in effect, we just had the executive board meeting and the trust board meeting on a monthly basis. If we did go into that, it would seem that we would certainly hope not last for more than a couple of weeks, but I think it's useful to flag to the board that we might have to go into that extreme position if we needed to, and then we would revert back to this model as we move forward. So we wanted to share that with the board in case that did emerge, but one hopes that it doesn't. Okay,
thank you, Chris. And I think it's probably worth noting that another reducing the burden letter has been received, hasn't it?
I was just going to comment on that, if I may, Krishni, very briefly.
Please do.
Again, yes, we have received that. I think positive assurance to the trust is that I think we are largely in a good space on that. We are doing most of what is set out. For example, we may have to revisit appraisals. I think the thing to flag in that, it is somewhat hidden in it, but in the overarching letter, it does say that things will be reviewed. The letter from Amanda Pritchard, it says that things will be reviewed in Q1. So, I mean, that does suggest that whereas maybe when we initially looked at this, we hoped we might be starting things up towards the end of February or early March, I think that does suggest that this may well go on longer. It might well be that we're not starting to move back to a fuller model until May, probably at the earliest. So I think we all need to be aware that we probably are going to be facing this approach for some time. And again, that's an important thing for us all to note, I think.
Yeah, thanks, Chris. And I think absolutely, I think critical. We certainly will need to make sure that we focus on key priorities. And clearly, we have on our agenda that the key areas of focus we have sort of throughout the pandemic have highlighted our 6 key areas of focus, and I think we do and will need to challenge ourselves on what we can realistically continue to do throughout this period. But that doesn't necessarily mean that we will, step everything down. And we ran a very successful members event, which I will come back to, but that felt like a really important thing to do for our community. Hence we did that. But I think it's always measuring everything by how critical it is for support for the community, for our staff, and obviously services, critical services to our patients. So no doubt you will keep that under review, but important to note here nevertheless for the board. Okay, if Richard, you wanted to come in.
Sorry, just one other thing that I think it's important just for the board to be aware of. So again, Amanda has identified that they won't be initiating a planning and contracting round before the end of March, and the current financial arrangements will roll over into the start of the new financial year. So again, that is a change obviously from what we were previously anticipating. Yeah,
thank you, Richard. And presumably there will need to be further advice about annual report and accounts, and I think there might have been a comment on quality accounts already in the reducing the burden letter.
Yeah, the timetable's been issued for annual report and accounts. I think there's an extension of 1 day for providers and a couple of weeks from the normal timetable for audit to take place, and we're just working through the detail of some of that guidance now.
Okay, thanks, Richard. Angela?
Yeah, just to say, in light of Chris's comments about the sort of longevity that we can anticipate and are experiencing, just to assure the board that the execs have now captured what we believe to be the strategic areas of focus still required for this particular quarter, and trying to capture the strategic risk of not doing those or continuing, obviously, assessing the capacity that we've got in relation to that, and certainly working with Sandra too. We met this morning to understand what options we've got to try to manage and support that. So assurance to the board that we are actively looking at that and anticipating the longevity.
Thanks, Angela. Maria?
Thanks, Krishni. It was just to follow up your point about the governors, and appreciate the standing down of their meetings continuing, but will things like the keeping in touch briefings continue for them, and some of the work that they're working on themselves will still be continuing, presumably?
I think that's a really good question, Maria. Thank you. Yeah, so I think absolutely, the plan will be to run more keeping in touch briefings. So I think it's really important to keep our governors up to date with what's happening and the Trust's response to the pandemic and changes. For example, I think we, as highlighted in my chair's report, we did have one after the last board just to keep governors up to date with our financial position, for example. So absolutely, I think we do need to do those. And there are certain key statutory duties that governors are actively involved in, not least appointment of the external auditor. And actually, of course, things like NED recruitment will need to continue because, those are things we will have to do. So I think certainly Fiona and I have already discussed sort of some of the, things that we must support governors to continue doing, and we're absolutely committed to those because actually they're very much in line with their statutory duties, and that's important. So yeah, thank you, Maria. And I think that probably brings this item to a conclusion. I mean, probably just to recognise, I've noted actually that even our regional boards have been stepped down. So Angela and I normally attend a regional board chaired by the regional director. Now we are attending sort of regular, both still continuing to have contact with the region through our regular, more informal calls, but really formal board activity, the regional people board, for example, all of those have now been stood down for this month, and no doubt we will have to keep those under review. So I think there's a recognition clearly regionally and throughout nationally that the pressures are sufficiently significant that we need to keep these sorts of things completely under review. So thank you. Nothing else, Chris, that you wanted to comment on? Happy to close?
No, I think that covers it all off. It's good.
Okay, excellent. Thank you. Right, we're moving on then to our strategy section. And first and foremost, we just wanted to get any general points around what's happening in our environment and particularly our system that we've not been able to cover in any board. So this might be verbal points. Angela, anything you wanted to bring in here?
Yeah, just a couple of points, Krishni. So we continue to meet as a partnership board. So this is the STP Emergent ICS board, and I think just to share that we did have a very good discussion on mental health last week, and the mental health collaborative, and our intentions as a system to work as an emergent ICS in that way. I think it was well received, and Rackham did the main presentation, and I think it is a really great example of the work that we've done in partnership, and gives an opportunity for the system to consider, you know, how the mental health collaborative can be a blueprint for other areas. So I think it was a good opportunity, an important one, and more to follow on that. The second thing I would say is that the Chief Exec of the Children's Trust, Colin Foster, met with him, and I think it's increasingly good to have Colin with us in the county now, focusing in the Children's Trust. Of course, the Children's Trust has a real clear priority around safeguarding and children's social care, but I think Colin brings a wealth of experience in that regard, so that's really encouraging. And finally, on that note, in terms of children and young people, we're continuing to build the work that we started with the Children's Summit last year, where we got partners together to focus on children and young people, and I'm pleased to see that we're now moving forward collectively with people like Colin, Kathy Hadley from the Director of Children's Services and the CCGs to think about consolidating the priorities for children and young people. So again, very important and significant, particularly in this COVID context as well. Thanks, Krishni.
Thanks, Angela. And certainly, I think some, you know, for the time being, certainly all the system meetings are continuing, aren't they? And as you say, we both attended the board meeting last week, and I certainly continue to meet with the chairs on a regular basis as well, and keeping in touch with colleagues in that way, which I think is helpful in terms of the whole system working approach we're engendering. Are there any other points generally that any colleagues wanted to bring in? Chris?
Yeah, just to say, people may well have seen in the ICS submission the overall system plan. We did quite an in-depth workforce plan from the People Board, with Angela's support on that. And just to say, we shared that with the Regional Director, Steve Morrison, and he was very complimentary about the work. As both myself and Mark Smith met with him and his deputy, he's very complimentary about the approach to workforce across the system and the work we were undertaking, such that he even asked whether we might potentially buddy some other systems and give some advice if needed. So I think, you know, in terms of the workforce discussion we've had, I think it's good to know that the system is working well, and certainly I know with the system's done a lot of work, effective work in the Bureau to support the COVID vaccinations as well. So again, I think important to update the board that that's where we are.
Thanks, Chris. I thought it was excellent seeing all the workforce, the detail of the workforce activity across the system represented in the ICS plan. So really welcome to see that, and the sort of subcommittee structure underneath the local system people board. Thank you, Chris. If there are no further comments, I shall move on to the chair's report. So I'll take the report as read, but just wanted to highlight, certainly first and foremost, to welcome a new governor who we welcomed at our last Council, Alex McPhedran. Alex is welcomed as the Service User Governor, and Alex took over Tremaine's former seat. You know, Alex has a really interesting background, so very much looking forward to working with him on the council. I also just wanted to congratulate everybody who was involved in putting together what we called our Blue Monday event. The event took place on the 18th of January, which was the day on which this concept called Blue Monday apparently happens, and there were some excellent contributions, not least from our IAPT team, who really I think the feedback which was really positive was how the language, the the explanations were actually for people, were really easy to understand. It was not overly technical. And most positive, you know, what was really lovely was a member of our staff actually contacted Angela and I to say how helpful it had been for her actually. And although it was originally aimed obviously at our wider community, if you like, and our stakeholders, and we publicised it widely, we have, I believe, circulated it to staff as well, because of course it's available for watching back. And there were lots of really practical tips and hints about looking after your mental well-being and your mental health and access to services. So it really did what it said on the tin. So I'm really, really thrilled that we actually managed to pull it off despite some pressures. So a particular thanks to Fiona and her team, who I know worked really hard on it. Also the comms team, but also Chris Davison, who I know is, well, I hope is observing the board today, but Chris obviously was, as acting lead governor, instrumental in helping us get that off the ground. And we did have help from Dr. David Smart as well, from who I believe is now retired, but I think most of us will know David in the various guises in which he's worked. So it was really good, and I think it gave us a model for although it was hard work in terms of delivering a virtual event and a template for delivering a virtual community members event, it was actually relatively straightforward. I mean, hard work to get it up and running and make sure it was properly publicised and make sure the content was there and get the speakers, of course. But actually, once you get this sort of webinar format established, it is a really good potential model. So something we're going to hope to do going forward, and obviously particularly helpful to focus on mental health, I think, in that time. So I just wanted to major on that because we were very proud of that. Fiona.
Just to say, Krishna, I think we've had about 180 views on catch-up of the video as well. So in addition to all those people attending, a number of people have actually taken the opportunity to view it at their leisure. And I just think it just gives us such an excellent template, and we've learned so much from doing it, and we're really excited to work with the comms team to put another one in place. So it was really good, really successful, really satisfying to do.
Yeah, thank you, Fiona. Maria?
Yeah, I was just going to say I attended just for the last hour of it, and I thought it was hugely informative. It was really good, as you say, Krishni, in the way it was accessible, but it was really comprehensive in the information that came over. It's really detailed, and I think this is one of the big benefits, as Fiona's saying, of this new way of using digital technology, that a member event like that can be accessed at any time by any of the members, and they don't have to come to a place and see it as a one-off. So I think, as you said, it's a really good model. It's fantastic that the governors themselves kind of drove it and got it to happen. And it will be good to have that offering to our members going forward in terms of what they get from being a member. So well done to everybody who's involved in that.
Yeah, absolutely. Thank you, Maria. On another note, I just obviously wanted to say that in line with some of the comments earlier, really, that obviously one of the key activities that is underway is our NED recruitment campaign, and so there are some indicative timelines there, but we are I believe we are live now, or we're just about to go live with our campaign. Fiona?
Tomorrow the microsite will be going live.
Okay. So that will obviously enable us to also promote the trust, because you know, part of when you're doing any recruitment campaign, you also have the opportunity to talk more about the organisation and bring, you know, some of what we're doing to a wider audience. So another initiative that the governors will obviously be working with us very closely on to help make sure we come to a positive conclusion. I will, on that note, unless there are any questions, I'm going to invite Angela to talk about her Chief Executive's report. Angela, is there anything you want to highlight?
Yes, thanks, Krishni. And I know we touched on COVID, but I think it's really important that I'll take the opportunity to just thank our staff. You know, I'm never in any doubt of their brilliance, but they are absolutely brilliant, and we cannot be more thankful for what people are doing at this time. You know, they're adapting, they are going the extra mile as ever, and they are really, you know, really leaning into system pressures and understanding. So it's a fantastic work. And, you know, I was able to visit the vaccination centre this week, and I know Jean and the team have been, you know, key to this, but it was fantastic to see it in operation and to talk to staff, and, you know, phenomenal stuff. So enormous thanks to everybody on that. Couple of other bits then just to raise. There was a judgment, a mental health judgment on the 23rd of January around virtual Mental Health Act assessments. So it's important the board is cited on that. I will obviously and Jean will be working through those elements, and we will take information through governance forums in terms of any implications for the trust, but obviously an important judgment that all mental health acts will need to be face-to-face going forward. Just to remind people in terms of CQC that they will only be conducting inspections on a risk basis. That is still the position, but we continue to have Mental Health Act assessments completed, so that is being undertaken, and again we're getting correspondence back from CQC in relation to those. Again, really pleased to see that we have retained our prison healthcare contracts, and again this is a credit to people, operations, and you know David's team in particular, to get these awards during pandemics, which is always challenging. They're challenging at the best of times, but challenging in a pandemic, and also to extend those services to Peterborough, which is also a credit to our services, and the fact that we can extend. And then obviously we've mentioned that we had a WDES session yesterday, which was great, a real opportunity to co-produce as we'd want to, and what we do at NHFT. But just to formally thank Stuart Moore from NHSI for joining us, because I think he was able to give us a lot of the facts and figures and to really give us the sense of what other trusts are doing and share best practice. So thanks, Krishni.
Thanks, Angela. I just, for clarity, because I know there'll be people listening who may not be familiar with the term, but we've referenced WDES, which is our workforce disability standards, which very similar to workforce race equality standards are the standards that we are striving to achieve in terms of equality and diversity within the organisation. And I know there'll be governors who may not be familiar with those terms. Thank you, Angela. Any questions for Angela? And I just also wanted to, it already seems a long time ago, but it really isn't that long ago that we did have our virtual quality awards, which I know Angela referenced in her event and in her report, and that was a really fantastic event. I mean, very different, obviously, not to be able to see people, but still there did feel some energy, despite the fact it was all virtual. There did seem to be some energy and certainly some huge delight in the on the part of people who actually won awards. And it was lovely to see so many celebrities, the people that we know, kind of involved in talking about our staff. So that was lovely. So Angela, did you want to comment on it too?
Yeah, just to say again, I think it was an excellent example of how you can do things differently, you know, and I've commented in the report, but it just shows that, you know, what is possible. But also just to draw attention to, I've mentioned the Brackley Centre, the new facility, which again is a fantastic site for our county. But again, we've got video material. So even in these times when you can't visit the same, it's great to see we've got a video so people can still get the experience. And again, thanks to people who put the effort into getting that video material available. As I say, some fantastic new virtual connections going on. Thanks.
Yeah. Thanks, Angela. And I believe we've circulated that, because I think we were originally thinking about whether to include that, but felt that in the interest of time we should circulate that to everybody. So I believe that's gone around to all our governors as well as board members to watch at their leisure. I've certainly watched it and it was very good and very helpful. I will just note that I know Sandra needs to leave us shortly to join the ICC or to run the ICC call, I believe. So I'm just noting that so that everybody's aware that there will be the odd occasion where people aren't in the room. Okay, moving on then to the quality section of our agenda. We now have the assurance report from the Quality and Governance Committee. Moira, is there anything in particular as chair you'd like to bring to our attention?
Well, board members will have seen that we had quite an extensive discussion around workforce, which has been presented and talked about already in this meeting, so I don't wish to add anything on workforce per se, but we did have a very comprehensive and really useful presentation from Jenny Boyce, who's our lead nurse for infection prevention and control. She took us through in some detail the board assurance framework, and we were able to gain full assurance that we were compliant against the 12 key actions that asks us to comply with. But also Jenny gave some really good illustrations around how we handle outbreak management and how we take forward lessons learned. So I think just our thanks as a committee to Jenny for doing such a good job on giving us assurance. There is new mental health and LD guidance coming out around COVID and IPC, which we'll take forward at the next Q&G in February. We haven't seen that yet, but we'll seek assurance on that in February. And you will see, as previously, the safeguarding risk is still high. We did take some assurance from an improved Ofsted report for the county, and obviously some of the positive moves by the Children's Trust. But I think the view of the committee in December was it's still early days around some of the new communication framework we've put in place with our external bodies. So what we'll do in February is take a deep dive into safeguarding and make sure we have full assurance when Rose Lovelock takes that to the Q&G in February. But that's all I wanted to say.
Thanks, Moira. That's really helpful. Any questions for Moira? Oh, actually, I think Julie wanted to come in. Apologies, Julie. So Julie first and then Angela.
Thank you, Krishni. I was just going to update on the mental health and learning disability infection control guidance that has come out. And at the same time, a COVID guidance for maintaining services with health and care settings infection control recommendations, which is an update on the remobilisation guidance for infection control that came out during that period. So at the moment we're working our way through the changes within the trust, and we will be able to provide assurance at Q&G on both.
That's helpful, thank you. Angela.
Yeah, just thinking about the in-county safeguarding, which is, you know, it's very clear it is the system position, and as you say, rightly to be focused on it and the position. I just wonder whether there's any benefit in us also putting our own safeguarding and a level of assurance around that, so we can really see the difference or the differentiation. Because as we go forward in this pandemic, safeguarding is something we're very focused on internally, and I just wondered if there's a benefit of doing that.
Yeah, I think one of the things we'd need to take stock on in February is, once we've heard from Rose, is could we split out that risk in terms of an internal and an external risk, because it's stayed red because of external factors, and it doesn't, you know, that doesn't decry all the work that's being done by our internal team really. So that would be a positive move, and we can look at that in February.
Okay.
Yeah, great. So if we can leave you to take that to Q&G, Maura, I think that would be helpful. Okay, so next on our list of items is CQC inspection. So Julie.
Thank you, Chair. I'm going to take this paper as read, and I'm just going to update on a couple of things. So the CQC recently have released a consultation on their new strategy. The world of health and social care is changing, so are we. So it is on their website. If board members would like us to circulate the link, we can certainly do that. I certainly can send it to Richard and Jane. So that's open to consultation. I think it's to sometime in March, if anybody's interested in that, but we are looking at it as a trust anyway. And the other thing is to give you a bit of an update on the Brackley CQC registration. So there was a meeting the end of last week with our operational team, Giles West, who's been involved in the development, and Claire from the CQC, Claire, who leads on CQC, with the CQC registration team, to answer some of their questions, to provide more information. And there is a virtual tour being set up for the CQC on the 4th of February, and hopefully out of that should be a positive outcome for the registration. So we're just waiting for that at the moment. So
just to be clear, does the report talks about the impact on the ability to open inpatient beds at Brackley? Does that have implications, any other implications that the board needs to be aware of at this point, or is that something, you know, I'm just checking that we can that's just something we can manage, and there is no particular impact that we should be noting beyond the fact that it's not
so Jean, I don't know if you've got anything from operations, because we're still recruiting staff, aren't we? We're still waiting for the building work to be completed as well, aren't we, Jean?
Yeah, so the building work is due for completion, I think, at the end of next week, which is positive. We have a number of staff recruited to those posts, but they are currently being used at Daintree, because we have changed the criteria at Daintree in order to support the system. So I think the additional beds would of course be helpful to the system, but we need to do that in a really careful and quality focused manner. So the system is supportive of what we're currently doing in relation to Daintree. So as soon as we are able to safely open Brackley, we will do so. Great.
Thank you, Jean. That's really helpful. Anything else, Julie, that you wanted to comment on?
Thank you.
Thank you. Just a point of clarity from me was around the Action 1. What's the time scale for that? The community mental health services people with learning disability. I think we've said an extension for this action was agreed. When have we agreed it to? Is the question. I wasn't absolutely clear whether what the time scale, the new time scale is then.
I'll have to go back and confirm that. I can't tell you straight away without going back and confirming that question, but I certainly will confirm that back to you.
Okay.
I'll get that today.
And I think, Jean, I don't know whether this is an appropriate point at which to pick this up, but obviously we were hoping to have originally the adult ADHD team, I think, here, and for obvious reasons we decided it wasn't appropriate given the pressures of the pandemic. But just in terms of those waiting times, we talked, I think, back in September about recruitment and the plans we had. It just might be helpful to understand how, if at all, the pandemic might have impacted on that. So I'm just trying to get a sense of whether this is something when we could realistically improve the position given the current constraints, really.
Yeah, so I think from an adult ADHD point of view, the waiting time for first appointment has improved quite significantly, and we're now at, I think, just under 91% in terms of achievement of that. There is obviously work to do, and we will continue to do that in terms of that next appointment as part of the assessment process. For children's, it has been impacted more because of a lot of the assessment is undertaken in school settings in relation to those individuals, and obviously with the pandemic, a number of those schools have been closed for extended periods. We've also had we've implemented a new tool called Helios, which enables a significant part of the assessment to be done remotely by parents and their children, but a number of our people on the waiting list have declined the offer of utilising that, which has obviously had an impact. It is something that we're monitoring very carefully. All of the children have had clinical harm reviews who have been waiting for over 18 weeks, which I think is good. And that is now being tracked and monitored very carefully. So I have fortnightly meetings on that. I think in answer to your question, there has been an impact of the pandemic, but we are trying to mitigate that as much as we possibly can.
And have we? So I think we noted previously that a lot of really good work had been done to improve the time for the initial assessment, and clearly the performance on that, you know, is significant. Beyond that, in terms of waiting times for the actual first opportunity for treatment or an actual, yes, a treatment starting, that waiting time is still quite significant. So are we planning any action? I'm not asking us to confirm, you know, that we're going to conclude that now and quickly, just wondering whether we have actions in hand or are planning for actions that might actually improve that. You talked about the tool, but, you know, is that something we've got resource? Are we recruiting to it, for example? Other actions that we might be taking or plan to take around that?
So there is an extensive action plan which is being worked through in relation to how we can reduce the waiting times across all of our services, in particular the all-age children, all-age ADHD ASD pathway, and how we can do that in conjunction with primary care, because GPs do have quite a significant part to play in this, and there are a few things that we're developing across the system in partnership that will hopefully address that as well. So there is an extensive amount of work being undertaken by the operational teams, bearing in mind that some of that has been delayed because they are trying to manage their caseloads in a quality and safety way at the moment. So yes.
Yeah, excellent. Thank you, Jean. That's really helpful. Thank you very much. Okay. Any other questions regarding the CQC actions or anything outstanding, or any other points in Julie's report? Okay, thank you. Let's move on then to the Learning from Deaths and Learning Disabilities Mortality Review. Julie?
Thank you, Chair. I'll take this report as read. I've got really nothing to raise outside of this report. As the report identifies, we are doing the thematic reviews for Q2 and Q3, and we will report it to Q&G at the next Q&G meeting, as we did with Q1.
Okay, so just really for noting the key points in there, and obviously this will normally go through, as you say, Q&G as well, so subject to quite a degree of scrutiny. Important report, but for the board to note. Thank you. Okay, Julie.
Yes,
next we have complaints.
So we're now moving on to the complaints, PALS, GP concerns, compliments, and I want great care Q3 report. I'm going to take this report as read. You will note in this report we're asking for a decision on extending our complaints timescales during this wave of COVID. Looking at the national regulations, we had some advice from the Forum for Complaints of what we could do, because there won't be another stand down or pause of complaints as there was in the first wave, because the regulations allow it only once. So they've already done it once, so we have to look at things differently. So as a trust, looking at the regulations, we've asked for an extension. It's gone to Strategic Exec Board, but we'd like the board to ratify today that we extend to 45 days instead of 25 days. And then obviously in agreement, I think with another 15 days, you'll see that in the report.
And just to be clear, Julie, the reason for that is because clearly this has an impact on operational colleagues, doesn't it? Who then take part in investigating these complaints and obviously managing the complaints, and therefore the pandemic is clearly in action. So can we, any questions for Julie before regarding the report and comments? Nikki?
Thank you. Julie, I completely support extending that timescale, but can I just say that I would assume that if there were anything major or anything serious, that would be kind of speeded up and not given that length of time. So,
in line with what we did before, patient harm and safeguarding will be managed as we did in the first wave, because even when we paused in the first wave, we still prioritise those areas.
Yeah, super. Thank you.
Okay, thank you, Nikki. Are there any other comments from colleagues? Okay, I don't see any. So can I take it that everyone is happy to support that extension, bearing in mind that the clarification that obviously any urgent harm concerns would be addressed in the sort of as an absolute priority within the normal timescales? Okay, I take it that the board is happy to support that change. Okay, I can see some nods, so I'll take that as assent. Thank you, Julie. Are we happy to move on then, Julie, to your serious incident learning assurance report?
Thank you, Chair. I'll take this report as read as well. I apologise for the late arrival of the appendix for this report yesterday. That was due to some technical issues. The only thing I really want to bring here is obviously the Never event. The actions are now overdue, but it's related to the external organisation that we're working with, so they have been extended, and I just wanted to inform the board on that.
Okay, any questions or comments on this report? I think at the moment, Patient Safety Committee has been running, hasn't it?
Yes, it has. Yes.
So clearly there is a level of scrutiny occurring at that committee, and I think Nikki attends that as a non-executive. So we're obviously getting additional assurance through that committee. So any comments, Angela?
Yeah, just to say, in terms of, obviously in a challenging period, and as you say, patient safety continues, but are we clear and confident, Julie, around assurance about learning lessons still happening across the trust, and making sure that is not missed opportunities, please? Obviously the Learning Lessons Exchange isn't running at the moment, but we are sharing lessons through SIs. We're doing that with IPC. You will see a lessons learnt going out today as a series. So yes, we are. Things are still going in through relevant groups that are running for lessons learnt, and we do share with DMTs as well. So there is, but we haven't got the formal group running at the moment. Okay.
I can see Jean was going to come in there, but I suspect Julie covered it by saying that it's reported reported into the DMTs. So and I think that's really helpful assurance to illustrate the process of identifying improvement opportunities or actions or learning, and that being fed into Jean's team to make sure that where they are within the scope of Jean's responsibilities, that those are being taken forward. Okay, thank you very much, Julie. And your final paper, at least on your own, because the next one after that is shared with Chris, is the Monitoring Workforce Safeguards paper, Julie.
Thank you, Chair. I mean, we've already talked about the risk of workforce at the moment around COVID. And also, obviously, we're in winter pressures, so we have pressures on the workforce this time of the year anyway. So this report, as we agreed before, is very much based on where the high risks are at the moment. Rather than having the in-depth mitigation report that we normally get, we're assured that those are being managed. As you will see, district nursing is one of the areas of concern, and you would have seen through a series of my reports some areas of concern around district nursing. There is some work going on in the background. There's a piece of work looking at the governance of district nursing. We're looking very closely at the workforce around district nursing. So I just wanted to give you some assurance that we also use an off-framework agency, because we are challenging to get staff for district nursing. We did bring in some staff on long-term sort of agency contracts. Some of those stayed for a short while and found the workforce pressures quite high, so ended their contract with us. So there are some challenges in district nursing at the moment. It is on the list of the clinical leads, group of priority services, district nursing
because it is seen as a priority, district nursing and ICT at the moment, along with the services in the acutes.
Thanks, Julie. It was also referenced in the CQC report as well.
Yes.
So is that mainly born out of this capacity constraints?
Some of it's to do with capacity, and as you will see, there was also has been an increase in SIs over the last 12 months, and the CQC raised some concerns. We have a meeting in February with the CQC to talk through the work that Jean and her team are undergoing in terms of the transformation, and how we're supporting the workforce, and how we've looked at the SIs. And they did raise, as you know from the report, an SI in 2019, which has got some similar themes in an SI, which hasn't concluded at the moment. In fact, is just about to conclude, and there'll be some learning from that.
Okay. So is that something that Q&G will be looking at? I can see Moira is nodding, so you're focused on it at Q&G, which I think is important.
Yeah.
Okay. That's good.
After Angela's asked a question, I've got something else to add.
Okay. Thanks, Julie. Angela?
Yeah, thanks, Julie. And I think, you know, again, assurance around the work that's going on around adult community nursing, and what was pleasing was when the CQC discussed it, we were clear that those actions were already in play, which is also important to share, and also to look at learning from other areas, because of course, you know, the pressures that our teams are experiencing are not peculiar to us. This is a national issue, and I think we've got more to do individually in the trust, but also collectively around that workforce pipeline, because we know that that is significantly challenged in this regard, and not easy to get international recruitment to replace this. So it is a real wicked issue. But the other one that I wanted to raise was around CAMS, because this comes up as an area of 100% occupancy all the time, and I think is a very challenged and increasingly challenged position through COVID effects. So again, just to make sure that we are citing the board on what we're doing in relation to that, and how we're supporting staff working in those areas would be good to share, please.
Jean, do you want to come back in?
I'm going to say Jean is probably in the best position to answer that question.
Jean.
So as Angela quite rightly says, we have had sustained pressure and increasing pressure in our CAMS units, and the predictive modelling is expecting that to continue for some time. We have done quite a lot of work in relation to supporting staff in our inpatient units, as well as making sure that we have additional staff recruited. We are over recruiting to those areas to ensure, because some of the children require additional staffing that's currently outside of our model. However, we've also had ongoing conversations and discussions with this at regional and national level. It is an issue that is across the country. We are not special in some respect in relation to that, but we are also looking in conjunction with David's team about how we can do some intensive support outreach for young people to try and prevent an admission if possible. There's quite a lot of work going on there, and we're also looking at how we can reduce the number of children that do escalate and require admission. So there's quite a lot of work that we're doing just to try to bring down that element, and of course the work that Dave and his team are involved in relation to the new care models going forward will also support that.
Thanks, Jean. So back to you, Julie.
Yes, we've been looking at the next establishment review, which is due to come to board in March. And we would like to make a request that actually goes to Q&G in April rather than March, because of the pressures on COVID for our staff, and also the change in the client group on the wards wouldn't give a picture of what the establishment should be. It will give us a picture of what we're working through for COVID, but also the wards staff have to put a lot of work into completing the dependency tools that we have to use, and the pressures on those staff at the moment would really ask that we could have a month's delay and then assess it and see if that's appropriate. So I would ask if we could have that extension, and if the chair of Q&G would be happy to take that. Any
concerns about that from anybody, or questions? Okay, I think we would absolutely support that. I mean, I think it's not. I mean, most importantly, I think it needs to be. It's an important task, and it needs to be done at the most appropriate point. Yes. I think is the first point that you made, and I think we absolutely must take account of the capacity of people to do that. So it seems like a sensible option. So we're agreed that the next formal iteration of that process should be reported to Q&G first and foremost in April. Did we agree?
Yes, and then Q&G can provide the assurance to Maze. Yeah.
Okay. Okay, thank you very much, Julie. So that covers all the main standard papers that we would have reported here. I can see Melanie has raised her hand. Melanie?
Hi. Yeah, I just had a quick question, maybe to Julie off the back of this last paper, but also maybe with Chris. And I was particularly looking at the healthcare support workers recruitment, which of course is great news. And there's a very clear and robust plan laid out in the paper to recruit. I just wondered whether at the moment we were seeing any impact of the current pandemic, but also the news around the stress of working in the NHS, whether that was having any impact on candidates, candidate levels, people sort of applying for these roles, or whether we were remaining confident and seeing a very kind of, sort of good and buoyant market in the candidates coming forward for this kind of activity.
I can see Trudy has raised her hand, so I suspect Trudy would like to comment. Trudy?
Yeah, Melanie, we haven't seen a reduction in candidates, to be honest. We always do really well for healthcare assistant roles. So that's been really positive. I think obviously the nursing market is quite difficult, but actually for unqualified staff, then we are managing to get high caliber candidates, and we're also looking at attracting people from other areas who perhaps have lost their jobs, in other markets, and how we can actually bring them on board, get them through the care certificate, and give them a career in health.
Thank you.
Okay, thanks Melanie, thanks Trudy. Okay, so I think we've brought all that to a close. Our next item is the annual Equality Information Report. I'm conscious that we are due to have some visitors for this item, but they may not be. We're a little bit running ahead of time, which is not something I would normally say at a board meeting. But I will say, actually, and I didn't say at the beginning, this will, we have deliberately kept the board meeting as focused as possible in terms of agenda items, and we're trying actually to conclude this meeting more swiftly than we normally would because of all the pressures that are currently within the trust. Actually, it is not really in that context surprising that we're a little bit ahead of time. But Jane, yeah, I think, shall we take a short break so that we can get Diana? I think we're expecting David Ledger, Diana Belfon, Veronica Mickelberg and Linnea to attend at 10:45. So it's probably opportune to take a 5-minute comfort break and grab refreshments, and then we can be ready to start at 10:45, please. Thank you. Please remember that we are recording and live streaming, so you may wish to turn your camera and your microphone off if you haven't. Okay, so welcome back everybody. Hopefully everyone's back with us, and I'm just wanting to check that we have our guests with us.
We're here.
We are here.
Are we able to see you? I can't seem to see you, so have you got your screens on?
I do.
Yes.
Why is that? We can't. Is it just me?
No, it's not
My
just
screen
you,
is on too.
I can't see.
Okay, let's just make sure that. Might go to large gallery.
If you go to large gallery, I'm able to see people. Yeah.
Okay. Ah, I can definitely see David.
Yeah.
David is the only person I can actually see, so that's
although that's Linea's there.
Linnea. Yes. Yeah. Hello, Linnea. Excellent.
Hi,
and so have we got Diana? And I think were we expecting Veronica as well?
Veronica's
Yes.
there.
Veronica, there you are.
Hello.
Great, lovely. Now on the bigger picture I can see everybody, so that's great. Welcome. Really great to have you here with us today. Thank you for joining us. So does Julie or Chris want to introduce this item before we go on?
I'd like, so I think Julie might want to introduce the E&I bit, but I'd certainly like to just give a brief overview of the RES. So if I can just say that I'm very excited about this RES plan. It's been through an in-depth process and a real co-production process. We've worked very closely with Linnea and Diana, David and myself, and also with the networks as well, the network. This originally was developed earlier in the year, but with COVID has been a real challenge. But from September forwards, we started to develop this up, and we've now had it agreed by the Strategic Exec Board. We've also taken it to the Diversity Network, who've agreed it, and it was finalised and developed through a really exciting co-production event, which we mirrored, as Andrew has already trailed earlier, with the WDES, which we'll also be bringing back. But I think this has got, everyone feels this has got some real grip to it to change the culture. So the recruitment experts, people may be aware of the RES challenges we have there of BAME staff not getting the same opportunity through the selection process, bringing recruitment experts into the process to really ensure that we can improve the quality of that. Also working with L&D to create talent pipelines for BAME staff. And another important thing will be a really in-depth training program for senior staff, that we can really get people to think about the issues within race and really use that to start to change the conversations in the organisations. They're just three key highlights. So really exciting about that, but I'll leave for the others to talk a bit more about it as they move forward. So I don't know, Julie, do you want to talk about the EDI stuff?
Yes, please. So this is the annual report we're presenting today that we have a requirement to load on the external website by the 31st of January each year. And the team that have come today have been the team that have been working to pull it together. So I'd like to say thank you to them for the hard work they've done, because this is, you know, during COVID, to pull off a report like this is something special. I would just like to say that you have received a draft report today. The final report was actually available yesterday, and I have sent it to Melanie, because I did ask in this paper for delegated authority for Melanie and myself to sign this off. But the only difference between this report and the draft report is basically some proofreading. CopyCo wanted, who are the people that work with us on this, just wanted to do a final proofread on it after the changes, and they've taken out 2 references which were no longer applicable in the report. That is my understanding, all the differences. So I'd like to go over to the team who are going to tell you all about our last 12 months.
Julie, and thank you so much, Chris. I think, Chris, you've really covered a chunk of what David was going to talk about, so I'm sure David would be really pleased to hear that. I do have to say, unfortunately, Diana couldn't be with us today, but you know, we do have Veronica who is going to fill up the gap. So they will be presenting, David and Veronica will be presenting the report with me, and they will also be available to answer any questions that you may have at the end. I think it's fair to mention, as Julie said, that COVID did obviously present a lot of challenges for all of us. But I think as a trust, it's really fair to say that we've made so much progress when it comes to the equality, diversity and inclusion agenda, and we've kept it very much alive and active, and that's something that we are really, really proud of. The good news, another good sort of piece of news that I really wanted to communicate today is we've had some feedback previously that the report obviously is a bit too comprehensive. It is really long to read. I'm hoping that you will all get a chance to just go through it. But the good news is that we are working with our comms team to come up with sort of like a glossy, easy to read, a compressed version of that, and we exploring things like podcasts and videos and things like that. So that's something to look out for. It was quite challenging actually today to pick the things that we would be able to showcase, and we didn't think that we'll come to this point with so much to talk about, given the challenges presented by COVID-19. But there is actually a lot, and what you're going to see today is really just a snapshot of some of the things that we've been able to achieve this year. So I'm really conscious of time, so I'm going to go straight into the contents of the report. So if I could have slide 2, please. Can we all see the slides? I can't see them on my screen.
Not yet, Lydia.
I think Jane was supposed to upload it, if I'm right. I think that's what Veronica said.
Yeah.
Jane, are you still able to upload it for us? Or shall I?
Just coming up now, Lydia, just a second.
Thank you. Thank you, Richard.
Okay, we've got it. I've certainly got it.
Yeah, see it? Okay, so if I could have slide 2, Richard, thank you. So as Julie briefly said, the purpose of the report is really to document the trust performance and compliance with our legal requirements under the Public Sector Equality Duty, which is, Section 149 of the Equality Act 2010. And under this legislation, the trust has a legal obligation to publish compliance, and we have to publish this report by the 31st of January each year. So the presentation itself will cover some key compliance areas, which includes equality objectives, equality impact assessments, and also the equality delivery system, which is known as, the current version is actually EDS2, even though there are plans to roll out EDS3, and that should be coming in the near future. And my colleague David will summarize some equality developments from sort of, like a workforce perspective, which, as I said, Chris has already sort of, alluded to. And David will also give an account of some key exciting achievements that we've accomplished in the EDI, Equality, Diversity and Inclusion world this year. We thought it would be really important as well to share some areas where we believe we probably need to pay, particular attention to in order to stay compliant in terms of what we do in the EDI world. So Veronica will talk us through some, some key risks and mitigations, and she will finish off by sharing where our focus will be for this year going forward. And then we'll open up the floor to, for some questions, feedback, and comments as well. So slide 3, Richard. Thank you. So equality objectives, as a trust, we are required to prepare and publish one or more equality objectives every 4 years in order to comply with the Equality Act 2010. Not only am I delighted to say that this year we still went ahead and co-produced our new equality objectives, but actually we received an instruction, from the trust board to say that there wasn't any expectation for us to actively progress the equality objectives. But I am really proud to say that, we still managed to come up with a clearly defined sort of, work program for all the objectives. And as Chris talked about, how we co-produced the WDES, Workforce Disability Equality Standard, as well as, the RES, Workforce Race Equality Standard action plans. which we obviously are core elements of our new equality objectives, as I will cover in a moment. So really, in a nutshell, objective 1 and 2, they will be linked to the RES and WDES frameworks, and both of them are, really aspiring to improve the experiences of our colleagues from a BAME background, as well as colleagues with a disability. And objective 3 is really about, improving the equality impact assessment process in the trust, which we've identified that, there is room for improvement and there are gaps in terms of, understanding what's actually required. And we know it is, an important piece of work in the trust for us to be able to study the risks presented by any new changes or decisions that are made in the trust. So we've decided to make that, one of the key areas of focus, which is why it's it's actually the third objective that we've had to set. And last but not least, objective 4 really focuses on improving access for underrepresented groups in our community. And this year we've decided to focus on the perinatal and the mental health services, really looking at how we can improve service access amongst the BAME community. Next slide, Richard. So equality delivery system, as I said, we're currently on EDS2 and EDS3 is set to come anytime soon. So what really this system is about is to help, NHS organizations like ourselves to review and improve the services that we provide for our local communities and provide better working environments that are free of discrimination for those who work in the NHS, and actually while meeting the requirements of the Equality Act 2010. Again, in order to focus sort of on quality rather than quantity, what we've done this year is to agree to actually link in our EDS2 with the engagement work that my colleague Diana will be leading on. And as I said before, focus would be on the perinatal services. So what I will be doing is to actually review that service and collect evidence for EDS2. So we'll really be working closely with the perinatal team and, maternal mental health services. And what we've started to do already is to actually engage with, with the local communities, with our county partners, NGH, KGH. We've had, several meetings with Northamptonshire Race Equality Council, and we've actually come up with a co-produced plan on how we will be engaging with the communities to actually increase, representation in our services for those groups that are underrepresented. And that work will actually link into the EDS2 as well. So really this year we want to see sort of, a tight alignment in terms of the work that we do on the compliance side and actually the work that we do when it comes to engaging with the communities and the groups that we serve. So if I can have the next slide, please, Richard. So equality impact assessments, we were able to carry out, and this is something that we've shared with the ICC, robust equality impact assessments during, COVID-19. What I did is we came up with a rapid equality impacts assessment tool to allow us to capture, the key risks in the decisions. And, because we understood obviously a lot of decisions were made in the pandemic. And what we didn't want to do is to actually, miss on the possibility that, some of these decisions, if not properly studied, will actually discriminate or present, discrimination to various groups. So what we did is we came up with that tool, which allowed us to thoroughly consider the impact of COVID-19 on high-risk groups, such as, our BAME colleagues, pregnant workers, older staff and staff with a disability, and actually to assist us with the formulation of an action plan to mitigate these negative impacts. And we are also delighted to share that our equality team has teamed up with the quality team to review and develop a more robust equality and quality impacts assessment process to ensure that we are properly looking and studying, the quality and equality considerations, and that they are embedded in every change that is being, that is made in the trust. And the plan with that, with working with the quality team, is not only to come up with, with a simplified process, but what we are looking to do is to actually roll out training to make sure that those that are involved in the process of equality impact assessments or equality and quality impact assessments are really guided through this process, and they know what the expectations are, and they are fully confident in actually completing the equality and quality impact assessments. So I'm going to hand over to my colleague David, who is going to give sort of a snapshot of what we've been able to achieve when it comes to from the perspective of our staff. So David, if I can hand over to you.
Thank you, Linnea. Yes, so our workforce equality information has been shared with the board on the 30th of July.
Sorry, David, can I just ask everyone else to go on mute so we don't get... so Linnea, you might need to go on mute yourself, or anyone else who's not muted, please. Thank you.
Oh, perfect. So our equality regulation report on equality data was shared with the board on the 30th of July. That included our workforce race equality standard data submission, our workforce disability equality standard data submission, and our gender pay gap. As outlined, there's a res action plan for the board to consider as part of today's agenda, and hopefully the WDES, the Workforce Disability Equality Standard Action Plan, will be coming shortly following the successful event yesterday. If I draw out some of the themes from our COVID-19 response, we recognised very early in April the disproportional impact that COVID-19 was having on sections of our community and our workforce, and most notably that was colleagues and people from Black, Asian and minority ethnic backgrounds. That really helped us maintain a focus on our equality, inclusion and diversity work. As Linnea's outlined, we undertook a series of equality impact assessments. That's a really regulatory tool that allows us to pull together some of the actions we're taking. And we focused our attention around gender, including pregnancy, age, disability, and race and ethnicity. Some of the actions that came and were incorporated into our equality impact assessment included collaboration with Leicester Partnership and Sussex Partnership to look at a wider data set and pull together a collective risk assessment. We run listening events across the protected characteristics, which identified some concerns and allowed us to rapidly put in place actions to mitigate those risks. And significantly, we developed very early on our individual risk assessment tool. We launched ours on the 6th of May, and that had input from our disability network and our BAME network. Some of those actions identified through the risk assessments ultimately has provided a platform for us to take our equality and inclusion and diversity work forward. So new action plans for RES and WDES, and importantly, be a springboard for the organisation moving towards being an anti-racism organisation. So I'll hand over to Veronica just to cover some sections around the future and our areas of focus.
Okay, thank you, David. Is it possible to have slide 8, please, David? I think it's 8, which is risks.
I'll just get those loaded up.
Thank you. So the risks. Sorry.
You want to go ahead, Veronica?
That's lovely, thank you. So the risks that we have identified is around accessible communication and information. So the team have identified that we've really got a lack of alternative communication options, particularly for those people with varying communication needs. Equally, for some non-English speaking communities, they are really missing up-to-date COVID updates due to the lack of this diverse and inclusive mechanisms of communication. Our next risk is around demographic service user profile data, and what we've found is that our patient data remains incomplete. Progression of this has been hindered due to the pandemic. However, we are committed to improve and progress on this. And then finally, equality impact assessment process. again, the team have identified that there's a general lack of understanding around this in relation to how to complete equality impact assessments and the impact on service provision. So if I could have the next slide, please, Richard, that'd be great. So the actions to mitigate this is to organise accessible information campaign. Now, work actually started on this pre-COVID, and our intention is to reinvigorate this and promote good practice across the trust. Secondly, with regards data collection, the team have made arrangements to attend staff star days county-wide to start discussing the importance of this and to provide that training that's been identified that's needed across the trust. And then thirdly, equality impact assessment process. The team are going to be sharing their equality dashboards with the regular DMT meetings, and the team will start to beginning to measure data quality improvements against the business data systems that we've already got, really checking for specifically completeness around individual characteristics. And also to contribute, the team will continue to contribute to this collaborative work that they've already started with the quality team to develop a training package around equality impact and to begin to roll that out across the trust. So if I could have the next slide, please, Richard, that would be lovely. And this is about what our focus will be for the next year, really. And this is around data quality improvements for our service users, looking at their demographic profile. And as both David and Linnea have said, COVID-19 has really highlighted the pronounced inequalities that are being experienced by specific protected characteristics. And we really want to ensure that the data that we're collecting is of the best good quality that it can be, to really help us to not only understand local inequalities for patients and staff, but really to start to address those inequalities. And this really links into population health inequalities, and the team will be focusing on how the services are commissioned, the gaps in that, and the responses from commissioners to this. And finally, fostering an anti-racist organisational culture, and this will be building on the great work that the Trust has already been doing around this, continuing with the collaborative work with LPT, but with the aim this year of really exploring and addressing racism that is occurring between patients against staff. And so that comes to the end of our presentation today. Thank you for listening. And if anybody's got any questions, I'm sure that we'd be happy to answer that. Thank you.
Thank you very much, everybody. I wonder if we can just remove the slides from screen so we can go back. I think you can click on the gallery view anyway, but just in case you haven't spotted that, it probably would be good to remove the slides. But thank you so much, all three of you. Very comprehensive, very clear view of the priorities and key issues and risks that we're trying to address. So we're a little bit over time already, but I am keen to let colleagues have the opportunity to comment or ask any questions. So if there are any questions in the first place that anyone would like to clarify, perhaps I can bring people in. Jean?
I just wanted to say how brilliant it is, and I think that the action plan is fantastic. And I was just wondering whether or not at the moment, I know it's a bit difficult to do that, whether we're on track to complete those actions, or whether we've got anything that you guys need any help from me from, really, in terms of how we can take that forward.
Thank you, Jean. Any comments from David, Linnea or Veronica about support needed from Jean and operational colleagues in particular?
It's obviously a really welcome offer, Jean. Thank you. And obviously worked really closely with Jean and Sandra and others to make sure that the actions we've put in place will have the impact that we want them to have, and also make sure that actually from an operational point of view we can really embed it so that equality, inclusion, diversity moves from where it is, in terms of HR responsibility, right into our everyday services and actions we put in place.
Thank you, David. I think that is such an important point. You know, this isn't, it can't be an HR initiative, can it? You know, it is, you know, obviously driven, you know, can be driven by the People Directorate, but I think it's really important that we all own it. We all have to own it to make it work. And I think Jean and support from Jean and Sandra in that respect is absolutely critical. So thank you very much. Maria, next.
Yes, thanks very much for the presentation and report. Really good. It was really good to hear the bit around the population health agenda that you're addressing in the work programme. And I was just interested to hear a bit more about, is this on the agenda of the Health and Care Partnership, and is there work we're plugged into at a system level across Northamptonshire on this?
So I'll bring Angela in, because I know Angela wanted to comment anyway. So Angela, do you want to comment on the health and equalities focus at NHCP as well?
Yeah, so a couple of things. I mean, I think that, again, you know, as we see the ICSs emerging, we do expect to see health inequalities increasingly focused upon, which we welcome. And, you know, in regional discussions, we are certainly talking about regional health inequality dashboards, which I think will also give us an opportunity to not only understand health inequalities more collectively, but also to focus our resources on them. So I think that's an important step. I think Linnea also outlined the fact that there is work in connecting organisations on this, which I think is also probably quite new steps for some of the organisations to connect with us in that. So I think that is really welcome, but significant as well. And I think the other thing I would say, I think if Diana was here, she would also say that there's more to do with our communities, and that we absolutely know that our communities need us to help them as well. And I think, you know, she would be pushing us very strongly to connect more with our communities, and it's good to see that we've got that on the agenda, but I think she'd be pushing us further. So I think as a board, we need to understand that we've got a role as what I would call an anchor institution to think about how we do that. And mental health's one area, but there'll be others. So that would be the comments I would make. Thanks, Krishni.
Thanks, Angela. Sandra?
Thanks, Krishni. I think, you know, we can acknowledge we've done some really good work in the past, but I think the context has made this year feel really different. And the co-production, I think, has been stronger. I think a lot of the actions feel probably more connected. Really aware that the context hopefully won't last forever, but what we need to do is keep that connection and keep that co-production and the work we've done and the sort of passion and the way we've moved it forward. You need to keep that truth, and I think just recognising that it feels different is really important, and be able to maintain it.
Yeah, thank you, Sandra. A really important point. Melanie?
Yes, just echoing the focus on health inequalities and picking up on Angela's comment around working with the local community groups. I had a discussion with Diana a week or two ago, and she was informing me about the way that the community groups are developing into hubs to coordinate their own response to some of these inequality issues. And I think, you know, it's important that we continue to engage within the community, but it's good to see the community also evolving their approach to make the role easier for NHCP and across wider public organisations. So I think there's evolution happening on both sides.
Thanks, Melanie. So, I mean, just a brief reflection from me. I really welcome the fact that the objectives represent both the experience of our people, our staff, which is obviously fundamental to everything we stand for as an organisation, that our staff have a really positive experience, and particularly those who perhaps haven't always done that because of, you know, their experiences with a protected characteristic. Improving that is an absolutely important commitment to make. And it's great to see that alongside a focus on health inequalities and, you know, the example of the perinatal mental health as a particular example. So I thought it was really welcome to see a range of objectives that actually reflected those different and equally important priorities. And the one other thing that I think was really, is really helpful, but does require ongoing focus, is data. You can learn from people's experiences, but to know that you're making a difference, you have to have data. And actually, our systems collectively, I'm not talking about NHFT, but our systems collectively have not enabled us to address health inequalities. Because, for example, ethnicity data is not easily available. And I know there was a recent, I think just this week, some further steps to try and improve the data, ethnicity data around COVID vaccinations. Now, you know, you don't know that you're reaching the right communities unless you have data to tell you that. So that connection about data and improvement, as well as hearing from people's personal experience, is really, really important. And it's great to see that the activity sort of reflecting the range of different things that I think we do need to tackle. So really welcome that. Thank you so much for taking the time to come and talk to us. There's lots of lovely comments in the chat boxes about, you know, all the brilliant work you all have done to help us move this very, very important agenda forward. And I think it's fair to say I don't think I'm going to ask the board to indicate its support, because I know it will support this, absolutely. And I think it's really great to get all the assurance we've had from you about the amount of activity that has been undertaken, but is yet to do, because we know this is something that we still need to strive towards. We are asked to delegate authority to approve the final version to Melanie and Julie. So I think Julie, somebody wanted to come in actually. Is that Julie? Did you want that to pick up that particular point? Because we do need to publish this, don't we, Julie? The actual report that we've seen a draft version of. So Julie, do you want to comment?
Just about to say, as we got the Melanie had the draft version yesterday, and it's only got tweaks in for proofreading, and the 2 references were no longer required. I wondered if we could provide that assurance here, if Melanie's happy to do that.
Yeah.
Yes, by all means, Julie, I agree.
Yeah.
Okay, excellent. So thank you again. Thank you, Linnea, Veronica and David. Great to see you here and hear from you directly. Because you know, it is a very important priority for us, and really welcome everything that you've done, and thank you so much for joining us. And Julie, we'll leave it to you to publish the report with input from Melanie. Okay.
Yeah, I'll support you.
Excellent. Thank you, everyone. So on that note, we shall move on to the next agenda item. We need to move on to our finance and performance section. So we have actually the usual assurance reports from Audit and Performance. So I would just invite, first of all, Alistair and then Scott, just to comment if there is anything particularly you want to highlight from your committees.
Thanks, Christine. I'll just very quickly run down the ambers, I guess, and take the rest of the report as read. 3 amber rated areas. One was the counter fraud progress update. I think that's really just reflecting the fact that we still don't feel we've absolutely cracked, in particular, our awareness side of things on counter fraud, but nothing to be particularly worried about. That work remains ongoing in that area. And then the internal controls assurance report. Again, we were very clear with Tia that as far as everyone was concerned, there wasn't necessarily any risk to the annual governance statement and that being able to be put out there positively in the future. It was more just about reflecting the challenge that remains to completing the programme of work by the year end, and the fact that we're ever so slightly behind. Obviously, the current COVID pandemic making some of the field work a little bit more tricky. And then one of the 3 reports that came out was actually discussed by Audit Committee on staff wellbeing, was also ultimately given an amber rating by the committee because it felt that it wasn't fully assured. And I think it's really important, given some of the discussions we've been having earlier, just to emphasise that I guess the reason it got that rating was it got 4 important and 3 routine actions to carry out. The report clearly recognised the fact there'd been an awful lot going on, and much of it seemed to be very, very successful. And I guess if I were to characterise many of the actions, it would be less about a failure to manage risk adequately per se. It would be more about pointing out scope for improving things further. So actually a pretty positive piece of work all round, I would say. The only other thing, probably just to mention very, very briefly, is that there was some thought we'd require an extra audit committee meeting sometime this month, actually, just to deal with some of the timings over the year with internal audit work and so forth, and the fact we've had some new accounting and auditing standards meant that we thought we might have to spend some time on that also with KPMG. But I think, again, we're always having to view these things dynamically with a view to taking up people's time and how we best manage that. Ultimately, we've decided against that. But I think, going forward, probably for work planning for next year, we will have to consider the number of meetings in a normal year and how we space those out, I think. Nothing else I wanted to raise particularly, so happy to take in questions if anyone has any.
Any questions for Alistair? Richard?
It's not a question for Alistair. It's just expressing my thanks for everyone's input into the internal audit work that we have done. As Alistair said, it is linked to our annual governance statement and has proved challenging, as I think Alistair reflected. So I'm grateful for colleagues who've been allowed that work to enable. And I think we're still in a bit of a challenging place in terms of finishing off all of those bits of work. So we'll continue to work through those.
Thank you for saying that, Rich. That was very remiss of me, and one of the things I had intended to explicitly say. Obviously on everyone else's behalf. Thank you.
Thank you. Thanks, Richard. Thanks, Alistair. Angela?
Yeah, it's just in relation to the counter fraud comments, Alistair, and the fact that, again, more to do in terms of raising awareness. It was just a question about how would we know when we've been successful, or what would be our measures, really, because it's a moving feast, this one.
It is. So there are a number of different measures one could pick. One is you go around and survey, which is what we've done in the past. However, as you know, we inquire as to how our staff and patients feel about a number of things in the course of day-to-day business. And so I think certainly where counter fraud awareness was concerned, the feeling of the committee has been sort of fairly unchanged now for a few years, that we've been really caught out by survey fatigue, for want of better descriptions. We've had very poor return rates on that, so I don't think they've really been statistically significant. Obviously, you can go around and collect anecdotal evidence and just talk to people, and I think there's clearly a role for conversations in departmental meetings about, are people sufficiently aware about the fraud risks that might be more key in their particular area of the business. But then, clearly you also have what are the number of referrals, and this is the thing that fundamentally we grapple with. We keep getting told that there is a certain base level of fraud that one could expect within a business like ours in the NHS. We get told that actually COVID-19 has provided the perfect environment for scammers, fraudsters to actually up their activity. So we're told that there's in fact increased risk currently. And yet, if anything, we've seen referrals in our patch remain at a very low level, or in fact decrease slightly. And that's where we make our slightly sort of harsh comments on whether we are being quite self-critical, I guess. But ultimately, we can't quite square what I think we all think must be an increased risk environment with actually very low levels of reporting. And that's really why I guess I pointed that out. And I think it is the activity of the fraud risk group and just continuing to leave no stone unturned about how we really, one, get the message out there, and then going back to your original question, Angela, build in adequate feedback loops for knowing whether we are being successful in that endeavour or not. Perfect question. Thank you.
Yeah, it's a really important point, Alistair, because and links then, it's the loop, isn't it? We need to make sure people understand the fraud. It's the fraud awareness, the opportunities there are for fraud. And actually, as we've always said, reporting, then actually high levels of reporting is a positive thing, because that means people understand it, are acting on it, and we can do something about it. Low levels of reporting should be a source of concern, particularly if it's out with kind of the benchmarks. I don't know if there is such a thing as a benchmark, but a low level of reporting, lower than expected would be.
We certainly have access to tiers data to allow us to do some benchmarking. The other thing I should have said is that we've been quite, because sometimes stuff might just not get characterised or labelled as fraud potentially. So we're doing quite a lot to make things like freedom to speak up and other channels through which something that might be relevant in this area might potentially come that everyone's working together to recognise when something could be a fraud-related issue and make sure it follows the appropriate channel.
Yeah, okay, excellent. Thank you very much. I just wanted to note as well that, of course, we did defer the Bribery Act training, but did complete it then in January, which is referenced in the report. So just for noting that although it was deferred originally, it has now been completed, that the board has received that. Thank you, Alistair. Scott.
Yeah, hi, Krishni. I'll in the interest of time, I'll keep it brief. I think, again, I'll take the report as read. A bit like the style that Alistair's taken us through, I would probably have focused on the ambers in a bit more detail, but I think the conversation that we've had this morning should provide some assurance to board that actually the areas that we have the ambers on, which were related to things like, our Agile Performance Dashboard, etc., have actually been explored in some detail through the conversation, as is our ongoing focus on the organisational risk register, etc. I think just a couple of brief comments from me. I just wanted to reaffirm the fact that within the Agile Performance Dashboard commentary, you'll see that there is further reference to the elements pulled out in the Workforce Safeguarding Report in relation to additional funding being available to go and perhaps recruit for unqualified healthcare workers. Melanie's earlier question highlighted that further as well. So, I think really important focus area for us going forward. And then I think the only other piece that I'll bring out is that we retain a focus. I don't want to get it out of proportion, but we retain a focus in regards to the Northamptonshire care record. We want to make sure that we, as a performance committee, are appropriately assured on the quality of information governance and system-wide data reporting, and that hasn't quite been nailed thus far. So we've retained it as an amber, and we'll continue to focus on that going forward. So I'll pause there and see whether there are any questions or clarifications.
So any comments or anything that people want to raise in response to that? Okay, thank you, Scott. So final main item we then have is the Agile Dashboard itself. Richard, is there anything you want to highlight?
Just a couple of things, Krishna, if I may. One, we talked about ADHD, adult ADHD earlier, and just to, that is in the finance performance section on the dashboard, as Jean described earlier. We have refreshed the mental health data, and we are looking at what else would be useful to bring into this. The only other area that I just wanted to mention, I think we've had some discussion previously about referrals from A&E departments for patients with a mental health condition into our acute hospital liaison team. We've discussed that with the mental health team, and the collective view at the moment was a sort of referrals picture might be helpful at this stage as a suitable metric to track. So we've included that graph on page 5, and you can see there is a differential in numbers of referrals from our DGH partners in the system, and you can see how that has tracked potentially some of the kind of COVID type issues that have occurred during the year. So we included that as a new area, and we will continue to develop and refine the dashboard as we move forward. Thank you.
Okay, thank you. Any questions for Richard or other colleagues regarding the dashboard? Can I just clarify? So we've touched on mental health liaison, Richard. I think we were doing a little bit of work, if I recall, looking at particular issues at KGH, A&E, and I wonder whether we've been able to take that forward. I think your time might have been looking at that. I don't know whether that has moved forward at all, and maybe the pandemic may have been a factor in that. Does that make sense? I was led to believe by Anne Rackham that there was some work to look at mental health activity in A&E at KGH.
Yeah, so Itai as linked in with medical director, I think, and comment.
I can speak to that if I may. Yeah. So we've progressed that work we're doing a review of, the satisfaction of the staff from KGH in terms of the service that we provide. And we're also doing a survey of, our own staff's experience of what's been going on. We're looking at the data in terms of, the referral information, whether some of those referrals are happening too early and that's affecting the experience. And that audit process is underway. And once we've got the results, we'll be able to, that will inform a discussion with the medical directors of the 2 acute hospitals about the way forward.
Excellent, thank you. Really helpful to note that that's being taken forward and all various aspects are being explored. So thank you very much. Thanks, Itai. And thanks, Richard, for the update on the Agile Dashboard. So we only have 2 items for information left on our agenda. One is just really noting the Declaration of Interest as usual, the register. Please remember to liaise with Jane if you need to update that in any shape. There's also the ICS designation letter available there for noting, and that was the letter that accompanied the submission. And I don't believe we have any other business, do we, that we particularly need to pick up in public board? I wasn't aware of anything that anybody wanted to raise, so I've got nothing to add there. So we are more or less on time. It does feel a lighter agenda today, but I think that was the right thing to do to make sure that we limit the amount of impact on executive capacity in particular. Everyone, any feedback anyone would like to give briefly on either the agenda or any particular items that we need to think about in terms of communication? Thoughts, anyone? Okay, Angela?
Yeah, just to say, I think it's really important, Christy, that we did lighten or streamline the board agenda today. I don't think it's a reflection of what's going on, though, and I think that's important to say. It isn't. And I think just importantly, whilst I thanked staff generally at the beginning of the meeting, I think it's really important that, I thank the executive and director team, because actually the amount of work people are doing to support the risks and the work of the trust is amazing. So the agenda does not reflect that, but it was the right thing to do.
Yeah, thank you, Angela. I think it's really helpful to record that and record the board's thanks, the non-executive directors' thanks in particular to the executive team. I don't think we can feel the pressure. Well, I think we can try and feel the pressure, but I'm sure I'm sure it's extremely challenging pressures that you're dealing with, and very grateful that we are, able to feel so assured about progress we're making on many fronts and keeping things running successfully whilst all these pressures are happening. So on behalf of the whole board, but particularly the non-executive directors, I want to thank the executive team for your exemplary performance in the way that you've been conducting things and managing the business on a day-to-day basis. So absolutely the right thing to do to reduce the agenda. And Angela rightly said, of course, there's not just the executive directors, but a whole set of other directors sitting here on this board as well, who I know are working incredibly hard. So thank you, everybody. Thank you for your contributions today, and for observers of the board as well for joining us today. Obviously, we'll keep everything under review to make sure that future board meetings, depending on the pressures, will similarly take a lighter agenda if we need to. And in the meantime, I think we have an opportunity for a break before we start the private board, which is due to start at 11:45. So thank you all, and look forward to seeing you shortly.
Thank you.